This is the updated flow chart for COVID communications. This is what we use for any staff or students who are in person who have been exposed to COVID, have symptoms, are awaiting test results, or have had a positive test result. This is updated, has been tweaked as we continue to learn how to be effective, efficient communicators, and certainly be able to communicate with families and staff quickly. We previously had implemented a form over winter break, and it just proved to be one extra step. And as a result of conversations with staff, administrators, all of our school nurses, this has worked quite well for us for the month of January. Three key things here. Number one, if you believe or if you have exposure, symptoms, test results, or you're awaiting test results, you must stay home until a nurse calls you. Second, staff, families need to call their school principal or their immediate supervisor. And then the third thing I want to note here, you can see the flow chart with who communicates to who and in which instances, but if you look at the bottom, that bottom rectangle, there is a district team as needed in the event that anyone feels that there may have been spread among two employees or two students because of being at school or at work. We immediately convene and we do consult with the health department because we know that COVID will come into schools from the community, but we want to ensure it is not being spread in schools. And to date, that hasn't been the case, but this team is ready to meet at any point. We also promised, in the spirit of transparency and certainly to promote health, that we would notify any in-person students or staff if there was a positive case reported. And this is just a template, but they mostly look pretty similar to this. We note the last date they were on site. We certainly don't identify them. And we also, as part of this process, have our school nurses contact any close contacts, and that would be someone who was within 6 feet for a cumulative of 15 minutes in a 24-hour period with someone who tested positive. And we certainly work diligently to ensure that we don't have close contacts and that we do maintain our distance during our day-to-day work. Again, this is a district COVID team that comes together in the need, if there's a need to discuss a particular case or sequence of events to ensure that we are keeping our staff and students safe. This is a snapshot of the weekly dashboard that's been in effect since December 7th, and we report every Friday by 5 the week's new cases, any clusters, and the cumulative reported positive cases since the 7th. Beginning on January 25th, our tracking sheet will update and we will start reporting the same information, but we will report that by work site or school and by students and staff. And we're able to expand this because we do have more students returning and staff, and we're able to report these numbers and not identify the individual. And we have ongoing means of which staff, students, anyone can report compliance concerns. We have voicemail, external phone number, internal extension. We have an email box. We also have a survey tool that we use. And in addition, we monitor compliance with daily walkthroughs, a checklist by our school worksite administrators, random review of bus and school worksite videos, and we have 2 plans under development to start recognizing our schools, buses, worksites with greater than 99% adherence to masking in particular, and we're implementing school-based and worksite safety teams.